If COVID-19 had knocked you down for a little while, you might have what is known as a glutathione deficiency. Well, a new review published recently by the American Chemical Society found that people with one or more chronic diseases who lack this powerful antioxidant are more likely to experience severe symptoms of the virus and, more tragically, even death. So what is glutathione and how do we try and keep on top of it? I'm joined by Coyne healthcare pharmacist. It's Giulia Criscuolo. Giulia, morning to you. I had to learn how to say it properly. Glutathione. What is it? And how do I know if I have a deficiency, even before I have COVID-19?
Hi, Gareth. Good morning. So basically, glutathione, it's called a tripeptide. In other words, it's made of 3 amino acids, glycine, cysteine, and L-glutamine. And it's made naturally by the body in your liver. And why glutathione is so important in getting this press coverage is because it's a really, really important antioxidant. Now, I'm sure we've heard the term antioxidant many, many times. And basically what it does in the body, we have things called free radicals, which go around, they're very, very unstable, and they go around your body desperately trying to find other molecules to engage with so they can become more stable. And that is called oxidative stress. And if your body has high levels of oxidative stress, then you find that you are much more susceptible to infections. Your immune system is not functioning as well. You get older quicker, your eyesight diminishes, you have more inflammation in your body, and you're much more prone to chronic diseases like diabetes, atherosclerosis, cardiovascular disease, and neurodegenerative disorders. And where glutathione comes in, Gareth, is that glutathione is a very, very powerful antioxidant. So it stabilizes the free radicals and makes them less reactive. So in that way, it actually protects your cells from damage, no matter what you're exposed to, whether it's pollution, bad food, emotional stress, or the COVID virus.
So is glutathione, and I'm asking a very medically ignorant question, and I can imagine viewers going, Gareth, how can you not know this? But I don't, so help me understand, the idiot that I am. Is glutathione, let's say I have a deficiency, which, Giulia, you can help me understand if I do. If I haven't been diagnosed, what signs am I looking for, A? And then B, is this something I can buy over a counter? Do I need to go for a test to see if I've got a deficiency in glutathione?
Wonderful question, Gareth. So basically, how you'd know that your glutathione levels are low is that you find you have a brain fog. You're often very, very tired. You find that you have a lot of inflammation in your body. Your liver doesn't work so well. And so, in other words, you find that, as I said, you're tired, you're much more prone to infections, and you age much more quickly. So you have more grey hair, eyesight's not so good, and you're much more prone to these chronic diseases that I've spoken of.
Yeah.
So these are some of the signs, and yes, luckily, glutathione is actually made in the liver. And there are wonderful food sources of glutathione. So all your cruciferous vegetables like broccoli, kale, Brussels sprouts, cabbage, vegetables like garlic, onions, all your berries, raspberries, blueberries, those are all rich in glutathione. And also we can take wonderful supplements. I really like one called Biomax Glutathione, which is actually a naturally fermented, patented Japanese form of glutathione. And it's packaged in a liposome, so it's really, really well absorbed. And I think it's really helpful to get in extra glutathione through supplementation because we are exposed to a lot of factors in our environment which cause oxidative stress. So the body needs some help, and sometimes our food isn't enough. So something like the Biomax Glutathione really boosts the body's levels of glutathione and makes you much more healthy and less prone to chronic disease and to infection.
Giulia, let's talk quickly before I say goodbye to you. The reason I think it's probably not a bad idea for someone like me, you mentioned the 3 vegetables I'm sure I haven't eaten since a child, broccoli, cabbage, spinach. Just sounds terrible. I'll probably rather take a tablet before I eat that. Just quickly, we're talking about the dangers associated from this research with a deficiency in glutathione and COVID-19. We have about a minute and a half left. Just help me and viewers understand, what's this research saying and what's the connection?
The connection they found is that people who have low glutathione levels are much more prone to severe symptoms of COVID-19, especially those that have to do with oxidative stress in the lungs. So they are finding that if people have low levels of glutathione, they tend to get much more severe lung damage, which leads to a respiratory distress disorder and this long-haul COVID. In other words, where your symptoms linger for weeks and months on end. And mainly it's because of the lung damage. So if you up your glutathione levels, you are much less likely to have those very severe symptoms of COVID. So it keeps you more protected and also protects the lungs especially from oxidative stress. That's the connection, Gareth.
Well, I appreciate your time, and I think just as a proviso, Giulia, and I'm sure you're going to nod in agreement, we don't want to have an ivermectin scare here. It's not a cure for COVID-19, glutathione at all. It's an antioxidant. Please don't go rush out now and buy glutathione thinking it's going to cure COVID-19. It's not. It's a supplement. It'll help you. Giulia, it's always such a pleasure speaking to you. Thanks for your time. Giulia, Criscuolo, Coyne healthcare pharmacist, joining us. So glutathione, I think, is what a lot of people, if not taking, I don't know if I have a deficiency. I certainly don't eat any of those vegetables, spinach, broccoli. Ugh. I don't care what. Can't put enough cheese sauce on them. But maybe I should start and get some glutathione.
I think so.